everyone, and welcome to our discussion about making pleasure a priority. I am Galina Espinoza, the editor-in-chief of FlowSpace, and I'm thrilled today to be talking with these experts all about healthy sex. We're going to take a moment just to do some introductions. So Danielle, I'll start with you.
Hello, I'm Danielle Savory. I'm a sex and pleasure coach for women, and my specialty is really helping you get out of your head and land in your body and experience more sensual pleasure.
Please. I'm Maria Sophocles. I'm a gynecologist, and my sexual wellness journey professionally started many years ago designing sex toys, and kind of culminated last fall when I gave a TED Talk about sex in midlife and what happens to us, and that'll be out April 2nd, so I hope you guys can watch it.
Hi, thank you for having me. I'm Dr. Kelly Casperson. I'm a urologist. About 4 years ago, a woman was crying in my clinic about her sexless marriage, and lightning struck my head, and I realized, how come I don't know how to help her? I treat the men all the time, right? And that led me into creating a podcast, TED Talk, on why adults need sex ed, and really prioritizing the education for people and doctors to help take care of women.
I'm Dr. Karen Eilber. I'm like Dr. Casperson. I'm also a urologist. I practice urogynecology, so I fix sometimes the physical aspects of why women cannot be as sexually active as they would like. And I came into this space years ago. I helped co-found a lubricant company because there was really a lack of clean products, and it was really kind of amazing that we're so into clean cosmetics, but we didn't really pay attention to what was down there.
For sure. Well, lots of questions to get to, but I'm going to start by level setting because I promise this is a conversation about sexual health, but what does it mean to have a healthy sex life, right? We all wonder, is it normal? Am I having enough sex, not enough, too much sex? Is there such a thing? So Dr. Oliver, I'll start with you. What do you tell your patients a healthy sex life looks like?
I think one of the most important things is defining what sex is. It is not always penetrative intercourse. So being sexually active for one person does not equate what someone else is. And an indirect way to answer your question also is what sexual dysfunction is. It's when sex causes you distress and makes you unhappy. So a healthy sex life is whatever you consider is your sexual activity and makes you feel good.
Dr. Casperson, I'd love to hear your thoughts on that as well.
We don't get good sex education. We basically get a disease and pregnancy prevention plan, right? So where do we get our sex ed from? Our first boyfriend, Hollywood, right? And so our perceptions of what normal is actually very misguided, and we're always doing this comparison to things that aren't actually sex education. And I think an important thing to ask us and our partners is, what does sex mean to you? Really, and really using sex as really a platform for personal growth. How do I communicate? How do I prioritize what I want? It's really an amazing platform for growth.
Dr. Sophocles, healthy sex life. Patient comes in not happy with the sex that she's having. What do you tell her?
I tell her that a healthy sex life is based on comfort with your sexual self, meeting yourself where you're comfortable, and sometimes that involves bringing sociocultural baggage that sometimes we have to work on shedding. But like Dr. Casperson said, I think also a lot of it is pushing away social stereotypes and tropes of the woman who has orgasm only from penetration, and helping to correct what we assume they know and what their partners have led them to believe is normal. I think it's also finding joy, fun, creativity, and curiosity in your sex life chronically at any age, but obviously learning young. I mean, in our country, we don't teach pleasure as part of sex ed, and we definitely do not teach mutual pleasure. So I think those are important things.
And Danielle, you work with patients all of the time, clients, coaching them to have better sex lives. Why is it important? Why is sexual health so tied to our overall health?
Yeah, I think it's such a good question. And, one of the things I think that we need to start taking a look at is how we're even defining our well-being. I've been here with a number of different panels, and There was, Mitch was on stage here yesterday and she was talking about like, eat your vegetables, like go see your therapist, like do these things. And when we're talking about well-being, oftentimes it's like we're getting to the standard, we're getting to the bare minimum, and really what we're talking about is survival. And what I love for us to think about is like we are wired to experience more pleasure in our body, and we should feel good. We should feel good. This isn't about just like, oh, my nervous system isn't dysregulated, or oh, I'm out of the stress cycle, but what's beyond that? And so I see, you know, as clients really start feeling better, it's a overall quality of life. It's a happiness. It's like the flirtiness that you want to have in the kitchen. It's dancing with your kiddos. It's like actually enjoying motherhood instead of always feeling like overwhelmed and drained out. And then you see it, you know, happening like what goes on in the brain. And I think that's one of the most fascinating parts is really seeing that when women pursue pleasure, how it just optimizes our overall brain function and how we can show up from using our creativity to solve these problems. You know, it's like, again, so many amazing women in these panels this last couple of days. It feels like 2 weeks, but I'm like 2 days of panels. And, you know, and we're all talking about like disrupting the system and like not settling for fine, but like we have to start with like disrupting our own like nervous system to get to this place where like pleasure is possible and this container is happening so that we can go disrupt the other systems.
And how do we find the time to do that? Because I've been listening to all the panels as well.
Yeah.
And there are so many things, you know,
Yeah.
there's a whole checklist of items you mentioned of all
Yeah.
these things you need to be doing to make sure that you're taking care of every aspect of your life. So how do you make pleasure a priority?
Well, I think, again, when we look at how the brain works, and it's like, again, we have all these shoulds, like should eat your vegetables, should take time for this, should take all of this self-care, but to actually create new habits, we have to have a foundation of this basement of our brain. And the way that we get that is through rewiring our pleasure system so that we can actually follow through with these habits that we want to be having in the world. But it starts little. Like I start with my clients with like, I call it the mindful minute, and you have like 1 mindful minute a day. Like, let's just get 1 minute in. I have those big honking water bottles like everybody else, and you know, just like when I'm filling it up, it's always my cue. Like, drop into my body, listen to the water, feel like, you know, feel it like the ice. You know, it's like these little moments that start connecting us to our body and our felt sense and our sensual pleasure, which isn't necessarily sexual, but it's those small moments in between. And as you begin to develop that foundation, you do actually have the internal resources in your brain to follow through with some of the other big habits.
Right.
Yeah.
What about the menopause transition? Because that can definitely be a period in a woman's life where everything changes, including sex drive, desire. Dr. Eilber, can you talk about some of the concerns you hear from your patients when they come to see you and how to navigate those conversations with your doctor?
It's a great question. I mean, whether it is hormonal changes related to menopause, post-baby, medications we prescribe all the time, treatments like for breast cancer, when you have low hormones, it affects your libido, which is your sex drive. It also, unfortunately, affects our arousal, which is our body's response to being turned on. So if you're already not that turned on and then you can't lubricate well and sex is painful, that's a total turn off. So that's why, you know, things are great. Like Plus One has all these new products. This is where like vaginal dilators and also vibrators come into play, because even if you replace a woman's hormones, that does help a lot of women. But just like you were saying earlier, it's only one part of our overall well-being. So I can eat right, but if I really want to have maximum function of my body, I need to exercise and stretch. So we can take hormones, but if you really want to have maximum function, if you're not able to have sexual activity because it hurts, use a dilator, use a vibrator, use something to get, you know, back comfortable in your body so you can be sexually active with a partner again if that's what you want.
And Dr. Casperson, how do you have this conversation with your doctor in a way that you feel heard? Because, you know, we've seen all of the Instagram videos in which people talk about going to their doctors and being dismissed or being sent home with antidepressants or being told, like, that's just menopause or that's just aging. How do you push back against those kinds of ideas?
It's a great question. I want to normalize for people that physicians did not get trained to talk about sex. Physicians rarely got trained to talk about hormones and menopause. So you are going in, and I hate to use the word battle, but you are going in against a system that didn't prepare them to help you. So I really want to normalize that experience for people. Get educated as best as you can, right? On reputable podcasts or in however you like to learn, and then bring it in. And here's the pro tip for talking to your doctor. Say, I'm learning a lot about menopause, vaginal dryness, low desire, whatever topic you want to bring up, and say, is it possible that I could try this for 3 months, and then I'm going to come back and I'm going to tell you how it went? Doctors love that. Doctors love knowing. And then they're like, ooh, let's figure out if this worked or not. And I guarantee you, if you follow up and you say, you know what, thank you so much for letting me try that. I've noticed an improvement in XYZ. You've just empowered them to go help all the other people too.
Right.
So that's my pro tip for talking to the docs.
And Dr. Sophocles, what are some of the options that you should be exploring with your doctor if you are having some challenges or struggles around your sexual health?
Well, I think the first thing is to be able to have the comfort to leave the shame behind and be able to comfortably say to a doctor, my issue is pain, or my issue is dryness, or my issue is how I feel about my body, or my issue is that in school they told me masturbation was bad, or my husband is well endowed and it hurts, or I can't get aroused, or I can't have an orgasm. Actually, I've never had an orgasm. Or I'm on this dating app and this guy wants to do this and I've never done that. So it's finding the courage to say that. And then hopefully, if you have a clinician who's open-minded, which is a big given because of their lack of training, you'll have someone empathetic enough to say, okay, if it's pain, let's see if something as simple as a lubricant or vaginal estrogen could help you. Try it. If it's arousal, what's prohibiting that? Is it how you feel about your body? And what FDA-approved medications are out there, and what are the pros and cons of those? If it's orgasm, what do we have that can help you orgasm? Whether it's some of the awesome sex toys out there, or off-label use of topical testosterone. We don't have the tools we want because there is no FDA-approved testosterone in this country, which is one of the largest tragedies for women's health, in my opinion. I think that so you empowering yourself as a patient, as a consumer, can say, here's what my issue is, and what can you do for me? And if that clinician can't, and they're honest or not so honest about it, it's okay. Thank them and go find someone through the menopausesociety.org or one of the international societies or a great podcast, and find your sources and resources so you can find a clinician who will listen.
Or maybe even go talk to a different kind of doctor. One of the things that I think is so great about this panel is we have 2 urologists on it, which I think is a rarity when we're talking about sexual health. And I would love, Dr. Eilber, Dr. Casperson, for you to talk about why you might want to consult a urologist when it comes to your sex life.
So urologists are very comfortable with penises.
Or should be.
They like joking about things. They have a great sense of humor. And they're also very comfortable with hormones. I give Viagra and testosterone out at 10 times the dose that women need every single day. Now, it took me years to realize that, I didn't know how to take care of the women. But as soon as I did, I'm like, this is just as easy. It's just as simple. And now when a guy comes in to see me for erectile dysfunction, I'm like, what's your plan with this? And they're like, and I'm like, it's a she? Okay, is she getting the help she needs so that you can use what you want to use? 10 times out of 10, they haven't had that conversation with their partner. And I'm like, you need to go have a plan if I'm going to give you Viagra. So urologists, we're very comfortable with the pelvis, testosterone, Viagra, and sexual health. So it's very comfortable for us to be like, all bodies can benefit.
Yeah. I think one of the reasons to see a urologist is, just like Dr. Casperson said, we actually employ a lot of the same tactics we have for male sexual dysfunction, which Viagra's been a household word since I was in training in the 90s, to what we have for women. So, for instance, we actually did a study with regular use of vibrators, and we enrolled women between the ages of 18 and 80, and it showed that it improved not only overall pelvic health, like incontinence and prolapse, but decreased rates of depression as well. And the reason we did that study was it is par for the course. After a man has his prostate removed, we put him on Viagra right away. We even have a term for it. It's penile rehabilitation. We have nothing for the vagina after hysterectomy, after all sorts of treatments for breast cancer, things that just kill our sex life. So I thought, well, most women can't tolerate Viagra very well because we just get a bad headache. It's a great orgasm, FYI, but it's a bad headache. And so I thought, well, how can we get the same effect, which is just increasing pelvic blood flow, and vibrators and self-masturbation do just that. So that's why it's great to see, I mean, we love our gynecology colleagues, of course, but I think the urologists just bring a little bit different aspect because we actually get to steal what we know from men, like testosterone use, and apply it to women.
Amazing. And of course, we know that there are also lifestyle factors that can impact your sex life, stress, nutrition. Can you talk a little bit about that, Danielle?
Yeah, I mean, where do we begin with all of the barriers that women have for us to really reclaim our sexuality and to access pleasure? But I think, you know, some of the main things is stress. And we all know we're in stress all the time. There's this stress cycle, but like actually taking a look at it and knowing what it feels like in your body. So, you know, I've worked with hundreds of clients at this point, and most women don't know what stress even feels like. It's like, oh yeah, I'm stressed, but they're talking about the spinning in their head. They're talking about this like consumption of worry, of catastrophizing, of to-dos, of anxiety in their head, but they can't recognize when it hits in their body. And so understanding like what happens when your nervous system is dysregulated, what happens in your body and how that feels, is that level of awareness is going to allow us to see what are the triggers, like whether it's, you know, the mental and emotional load that most of us are handling, you know, being a primary caregiver in your home, having like building a business, you know, breaking the systems, all these things that we're trying to do, they can create this activation in our nervous system, which is a good thing when we want to be motivated, but when it gets out of balance, we're hanging out there all the time, you literally don't have access to pleasure in your body. You do not have the ability to receive how we're wired to receive. And so understanding like, oh, that's what it feels like when I get triggered. That's what I feel like when I transition, allows you to then create the safety that we need in our body. And I use the word safety. Most of us are like, well, I mentally feel safe. Like, this is my husband of 20 years, but then he comes to like grab my buns as I'm doing the dishes or something like that. And I'm like, hold on, like you know how it feels, and it's like understanding that this isn't a me and him thing. This is a human nervous system response to when we feel under stress, everything feels like a threat. Your kid feels like a threat, that email from your boss feels like a threat, that, you know, kiss from your husband, which you might actually like, all of that stuff feels like a threat. And so when we understand that about our nervous system and we can start to take, you know, empowerment of our own bodies and land in our bodies in a safe way, find refuge in our bodies again, then all of these things that are these external barriers start to be way more easier. And I think also, you know, Dr. Sophocles mentioned all the other things that we grow up with: shame, you know, religious institutions, you're a slut if you do, if you're a prude if you don't, like all these messages that we have learned, and beginning to unlearn those and reclaim our sexual pleasure. Yeah.
Dr. Sophocles, we've talked quite a bit about a loss of desire that can occur for some women. Let's talk a little bit about when sex becomes painful, because that can be part of the menopausal transition. Right. What is the conversation to have, and what are the options available?
So when I see a patient, again, you have to meet them where they are, right? What are they comfortable talking about? But I always ask them as concisely as I can, are you having sex and is it comfortable? Does it feel good? And if they squirm or look down at their feet, you know that answer's no already. And then you want to help. You do want to peel that onion a little bit and say, is it with deep penetration? Is it only certain positions? Is it at the opening? Introital or opening discomfort is always the most common. The opening is by far the most delicate area that kind of goes bad first. And what women so often feel is that it's only them, they're alone, they're broken, they're ashamed, they need to be able to have sex for him. I hear those two words almost always. I'm fine watching Seth Meyers or Trevor Noah, but I have to, I need to do this for him. He has needs. I hear that all day long. So I think that the important thing is to help them anatomically understand, and I have little velvet vulvas in every exam room that we do anatomy lessons, which are great. But it's to help them understand that there are ways to help. And I mean, we talk about Viagra as just this amazing powerhouse discovery, and I think we all agree it revolutionized sexual dysfunction for men. But I would argue that topical estrogen is our own superpower, and we do not need to be afraid of it. We have done studies of studies. We call it a meta-analysis, where we've looked at 100,000 women taking vaginal estrogen, and it has not been linked to cancer. And I will say this until I'm in the grave, probably next to Dr. Casperson. We'll be like, estrogen. Yeah. We're gonna be like, wait, it's still safe because come on, you know it. Because there's so much stigma around estrogen, there's so much fear, it is so hard to undo those fears. And remember that using a teeny whiff dot of vaginal estrogen is not the same risk as using systemic estrogen or any hormone. And so we do have our version of Viagra. No, it's not going to make a clitoral erection, but it will make comfort, and it will allow you to have sex. It will literally de-age the tissue. There are very few organ systems in our body, by the way, that we can de-age. Right? I mean, it's not so easy, even in this amazing era. But I would argue that vaginal estrogen is that for us. So.
And just by having these conversations, you all are doing so much to change the conversation. But what else can we do to push past these barriers? There's still a lack of research, a lack of understanding. Dr. Casperson, what are some of the keys you think to really making a difference in women's sex lives?
I think people just start talking about it. Like, you're destigmatizing it by talking about it, whether it's with a girlfriend, whether it's with an adult child of yours saying, hey, you know what, this is what I learned at this conference, or your partner. And women, they talk to me and they're like, you talk about it like it's the weather. And I'm like, well, it's just a topic, right? But people want to talk about this. Like, as soon as they start talking to me about it, they're like, well, that wasn't that hard. I'm like, you didn't die, right? Of like realizing all of this pent up thoughts and beliefs, once you start talking about it, like sunshine gets rid of shame. Right? And so it's really normalizing it, and then normalizing it for the people around you. You might go in, and the doctor you're seeing does not, I take care of this all the time. I've got so many options for your vulva and vagina. Like, it's not even, like today at brunch, I was like, or you could try this, or you could try this, or you could try. But not all doctors have that. But you just bringing up, like, listen, my partner, I love my partner, but it's really painful now. I heard about this, can I try it? So even you bringing it up to your healthcare provider, you're changing the world.
Mm-hmm. Dr. Alber, anything you'd like to add that we can do to push past these stigmas?
I mean, having panels like this, just people being present here is a big testament. And I think also just people who know, and we just want to reinforce what is the truth about estrogen. So I would love to just show you, I'm going to die with my estrogen patch on. I mean, we all practice what we preach. And, but these are important things, though, that I think you need to, we're not just here talking heads and telling you what to do and saying, if you just listen to us, you're going to have a great sex life. I think we are all women of a certain age. Maybe you're not yet, but
estrogen on the face.
And we've all. It's a thing. But I think that just by talking, and if you don't feel comfortable talking to your doctor, you have to realize that for someone to be comfortable to talk about sexuality with you, they have to be comfortable with their own sexuality. And I was saying this at dinner last night, as my girlfriends love to remind me, most doctors didn't go to prom, so it's really hard for a lot of physicians to talk about sex. So if you want to have a conversation, if you listen to Dr. Casperson, it's great advice, but if your doctor doesn't respond, it's just like any other professional. Maybe you need a second opinion. Maybe you need to go to the menopausesociety.org site. Maybe you need to ask your girlfriends, hey, who's managing your hormones? Because no one's going to take care of you the way that you are for yourself.
Yes. Right. Amazing. And that's the perfect segue to our final question for today, which is if there was one bit of advice you could leave the audience with about how they can feel more empowered in the bedroom, what is your best advice? Danielle, I'll start with you.
That's a great question. So I would just say to think about, like, it's your pleasure. Like, it's really about your pleasure. And we're so afraid as women to actually say that with bold words and to claim it because we've been socialized to not be selfish, to not keep it for ourselves. But when you start, like, to flip over this narrative and really own, like, this is about my pleasure. That doesn't mean I'm taking away from my partner's pleasure. It doesn't mean nobody else gets pleasure, but we need to step into this role of like, it's about my pleasure. I can create a container here to really receive pleasure, then the entire game changes.
I think well said. I want to just very quickly riff on the last question, though, because I think that, Galina, it's really important that everybody knows that sex is one of those wonderful things that is anatomical, physiologic, and clinical, but it is also sociocultural. And so if your clinician is not doing for you what you want, and you can't find someone who will, we are living in an era with an explosion of femtech companies and sex tech companies and companies like Plus One, and there are more sex toys out there than there have been in decades. The sex toy industry over the millennia, by the way, is cyclical.
That's going to be a separate panel.
A separate panel, sorry. But stay tuned for next year. But we're living in a cool one. So you can be a sexual consumer. You don't have to only be a sexual patient. I wish every doctor had our progressive desire to make sexual health as important as the rest of your health. But if it doesn't, and we can't all change that educational system overnight, you can go out online and find it. You can find it. And so I think that I just wanted to add to that.
No, I think that's great advice. Dr. Casperson.
I would say, going back to what I said about personal growth, it's so many women that I see. When a man comes in and I say, what do you want? They know what they want. When a woman comes in, I say, what do you want? They don't know what they want. These are grown women who make massive decisions every single day. They know what they want in many areas of their life. And really, this is a time to say, what do I want? What do I want this relationship to be? And really making sure when you're in a partnered relationship that this is a we, not a you. It's not another thing you're just giving, because we give a lot in this life. And then to plug ISHWISH, if you need a provider, International Society for the Study of Women's Sexual Health, they do hormones, they do sexual health. It's an amazing organization. You can type in your zip code if you want to seek medical help.
Okay. I just want to reinforce what everyone on the panel said. It's really about you. I think in general, as women, we always put everybody first. You know, it's your kids, it's your spouse, and then if there's extra time in the day, then maybe you might do some self-care. But you have to look at it as your sexual health is just like mental health. There is still a little bit of a stigma, but finally, after how many decades, people have realized that mental health is a thing. Sexual health is a thing. And you being able to make yourself feel good and empowered in the bedroom, just talk to yourself that this is part of my overall health.
Amazing. Well, I think you have your marching orders. Everyone needs to go out and have better sex. I'd like to thank all of our panelists and our partners at Plus One for hosting this incredible conversation today.